Hello and good afternoon and welcome to Optimum Derby Live. My name is Martin Crayson. I'm joined as ever by Tom Heeley, MD of Optimum. Good afternoon, Tom.
Good afternoon. How are you?
Good, thank you. Today is the second part of our new series focusing on football injuries, where we're just going to discuss certain injuries that many people that play football and certain other sports will certainly recognise. And today it's a topic that many of us have had problems with over the past, simply titled, Why Does My Groin Hurt? If you're with us today on LinkedIn or YouTube, you're very welcome. If you have any questions to ask during the broadcast today, which will be around 15 minutes long, please feel free to ask those questions and we'll get on to answer them if we get time. If you're not subscribed and you're watching us on YouTube, please hit that subscribe button and you'll know when we're back on next week for the third episode of this 4-episode series on football injuries. But let's crack on, Tom, for today. Why does my groin hurt? First of all, let's just, work out what constitutes the muscles of the groin. If you could talk us through what the particular area is, because there's plenty going on in that region.
Yeah, absolutely. Yeah, so I suppose groin is typically sort of, it'd be almost a triangle structure. If you were to, it sounds a bit crude, but if you were to almost like chop the body in half and you were to look at the inside, so if you were to look from, so take the right side of the body away and look from the right-hand side towards the left leg, it would almost be a triangle from your groin down towards your knee, would be a simple description. And that area includes loads of different muscles. So you've got your adductor muscles. So you've got 3 adductor muscles.
Talking.
Yeah, perfect. Yeah. So your adductor muscles, if you look at the image on the right, they will run off the bony bit, the middle of the pelvis. So almost where those 2 circles are, that figure of 8 almost at the front. Where that figure of 8 joins, they will run from there down towards the knee in different lengths. So you'll have one that will be short, one that are mid length, and then one that goes pretty far towards your knee. You've then got a few other muscles. So you've got your gracilis, which also comes into that area, sartorius muscle. But typically we would talk about your adductor muscles as being your main contributors to sort of groin or the groin region or groin related pain. That's not to say when we come on to another topic in a minute, there are loads of muscles you can see around the area, around that pelvis that do contribute to pelvic stability and stabilizing both halves of the pelvis, so the left and the right side.
Sure. We tend to see a groin injury is just like a groin strain, that area there, just at the top of your thigh. But there's a lot more that can go wrong in that area. Talk us through some of those various injuries that you can pick up. So obviously today's topic of football.
Yeah, for sure. No, for sure. There can be a lot of things that contribute to that area or give symptoms down into that area, should I probably say. So I suppose you can kind of categorize them into different areas. So you might have the acute injuries. So they're the ones where there's a one-off incident, you've probably overstretched, or you've gone to play a pass, or you've had a shot and you felt something happen. You've maybe gone to try and twist or turn, you felt something happen. So they're your acute injuries. Now, again, that could be your adductor muscles. So you could have a strain amongst one of your adductor muscles. You could have damaged one of the ligaments within the joint itself, so within the ball and socket of the hip. So as that sits into here, you've got a couple of small ligaments and also bigger ligaments that wrap around the ball of the hip as well. And you could have overstretched one of those. And then you could categorize things into almost more chronic issues. So you could have things like osteitis pubis, which is pain right at the front of the pelvis, where the front and the back of the pelvis meet, and that's just where you get a friction through there through instability.
Yeah.
And that's almost like just an irritation really between the 2 halves of the pelvis and the bone that just almost react to each other and kind of brings on an inflammatory response, and that can lead to some pain sort of into the thigh, into the groin. And then you've got some more chronic things. So you might have things like a hernia, so you can have like an inguinal hernia. There's loads of different types of an inguinal or a sportsman's hernia, and again they can elicit with sort of pain into the groin area. They've all got slightly different symptoms when you sit and talk to somebody and listen to their pain and their explanation, but they can all resonate with pain into the groin area. So I think the first thing we would probably do here in the clinic is we'd ask the question, how and when did it start and how long has it been going on for? Because that gives you a little bit of an indication as to what structures you're looking at, and you can probably rule some things out straight away just from listening to what the symptoms are and how long that's happening.
Yeah, and it always surprised me how much your groin's related to certain issues in and around that area. I've had a hernia operation before, and you don't think that's anything to do with your groin, because in your stomach, lower stomach, but again, it's down to your groin. And there's also things like sciatica as well that can come from groin pain.
Yeah, 100%. Yeah. So again, like there may be an issue with your back that you maybe unaware of that doesn't really give you any symptoms as such. It doesn't really give you any pain, but actually there might be some sort of compression amongst a nerve somewhere that's then eliciting pain sort of into that inside your groin, thigh region that you may be unaware of that can come on at random times. So you've got
this, Tom, while you're talking, just to show you all the different things leading into it there you've been talking about.
Yeah, so you can see the three big adductor muscles, your brevis, your magnus, and your longus. They all contribute to sort of pulling the leg from the outside to in, so bringing the legs together almost and squashing the feet. And that's obviously massively involved in kicking a ball, whether that rugby ball or football. And they're hugely involved in change of direction as well. You can imagine if you push off one side and load in, then you're going to have to kind of shift across the other way. And as you do that, those muscles are going to be involved in controlling the pelvis and the support of the pelvis.
Okay. We've talked about how many things relate to the hernia, but how many actual things relate to that pelvis area as well that can add or accompany the pain that comes from something regarding groin?
Yeah, 100%. So things like osteitis pubis, which we talked about earlier, which is almost the irritation of the two parts of the pelvis either side rubbing against one another. And even a lot of groin-related issues, the chronic stuff especially, are down to imbalances. And you can almost, if you almost imagine you've got, your pelvis is almost two halves of a polo mint and they both move independently of one another.
Yeah.
There's going to be times when, as you're running, one side is going to rotate and the other side is going to rotate the other way, and then they're going to rotate back and forth. And that's fine as long as they're controlled and as long as those motions are stable and not going too far into that excessive rotation. So you've got your hamstrings, which obviously attach sort of around your bum area and lead down towards your knee. If we stay on the back side of the body, you've sort of got your erector spinae muscles, which are sort of the top of the pelvis and then lead up towards your ribs.
Yeah.
They work in opposites. So your hamstrings are going to want to pull down and the erector spinae muscles are going to kind of want to pull up. And then on the front, you've got the abdominals, which will go from the front of the pelvis and pull upwards towards your ribs. And then opposite, you've got sort of your quadriceps and your hip flexor muscles that will pull down towards your knee. So in essence, it's like a seesaw in the middle. And I've been quite generic there with what muscles are around that area. There are loads of other things and glutes and other things that attach around that. But those four are some of the big key contributors to how much rotation and whether that rotation is controlled. And again, looking into that is really important to see if that's one of the issues that's causing some of the pain that you're getting.
Before we get into some sort of exercises that people can use to help them avoid groin pain, it's hard for us as part-time sports people to know what's going on down there. You've just described so many different working parts all working together. How tough is it for you to actually get to the root cause of a groin injury at Optimum Derby's clinics and the other work you do with regards to football and at St George's Park, etc., etc.?
I think a lot of it, like we said earlier, like you can, by listening to begin with and asking the right questions, you can rule a lot of things out quite. I mean, not rule them completely out, but kind of take them out of your head or top of the list anyway, and probably push them further down the list. And then it's a matter of kind of checking for range of movement. So whether there's a lack of range of movement that could be causing an issue. If that all looks okay, then maybe we move on to the strength assessments. Can we highlight any areas that need work or specific work? Are there some special tests that we'll do around that area as well to kind of elicit pain that will give us an indication or a strong indication that it's maybe a hernia? And we often group all these tests together as well. And by grouping them together, if you get 3 or 4 of them right, or 3 or 4 of them elicit pain, then you're probably going to be heading down this route.
Right.
If you have the mixed battery, then you're probably looking at something else. So, we kind of tend to group these things together in terms of testing. So you get stronger results.
Okay. So I've started the football season and I'm fit. What can I do to make sure that my groin stays tip-top throughout the whole season? Yeah,
good. Yeah, so there's loads of stuff you can keep doing throughout the season. Things that aren't necessarily massively strenuous, things that keep the flexibility, and also things that keep the strength within that area as well. Strength is one of the key contributors, or lack of strength is one of the key contributors to injury around the groin area. So some real simple things you can do. Copenhagen's, which I tell you what, if you've got a chance, have a look at the Instagram page. I did some stuff last week. I think there's 3 or 4 exercises on there. So Copenhagen's are one, and they're great to do. So they're like a side plank, but instead of your feet on the floor, your top leg is going to be resting on a box. So the inside of your top leg is going to be resting on a box. So start with the knee and then progress that down to the foot and make that a longer lever. So elbow on the floor, and then inside of the other leg on a bench or a box. Great exercise. And you can either hold that for periods of time, or you can sort of like rep that up and down. You've got other things like football squeezes. So you might put a ball between your knees and squeeze the ball, again, providing some additional stability through that area. And again, you can do that through different ranges of motion. You've got things like a goblet squat, so a squat, and a goblet squat with your feet turned out a little bit more, so almost like a sumo squat, so your feet quite wide. Again, challenges the groin through a big range of movement. Things like Cossacks. There's loads of variations of things you can do. Real basic stuff like cable kicks and kicks against the band, just to continue to strengthen through that area. And again, if you've had one of these issues, it's probably worthwhile keeping these things in your program as well at the same time.
Yeah. So people can find those on the Instagram page. I also think there's quite a few on the YouTube channel as well, Tom, actually, that people can find.
Yeah, I think there are from previous things. Yeah, there are. Definitely on the Instagram in the last week or so. Yeah, definitely.
Yeah. Okay. And like many other soft tissue injuries related to the leg, it's often difficult to know when you're actually ready to go back to action, and people can go back too soon, can't they? Is that something that you've seen quite a lot of? And how do you measure if someone's ready to go back to playing football or training even?
Yeah, 100%. No, there's a lot of stuff we use. So there's some real simple tests that we use, where we use a blood pressure cuff, so a blood pressure monitor, like a standard one that you would put on your arm and pump up. And we will pump that up to a specific 30, I can't remember what the measurements are now, milligrams of, I can't remember what the measurements are, 30. And then once the bag's inflated to that, we'll use that between knees. So push that between knees. Now, this might have been a painful test once upon a time, and we'll do what we call a groin squeeze. So squeeze as hard as you can between the cuff, and then we'll look at the screen on the cuff and the dial and see how far the needle goes around the dial. And we've got some set numbers which we'll use. Ideally, you need to hit these numbers in different ranges of movement to achieve good scores to be comfortable to go back to training or playing games. And that's something that we do here in the clinic. There's other stuff that you can do if you want to measure like other specific sort of strength areas, and we'll probably use the gatherer systems for that. But again, like just building up the strength through your exercises, and then to retest those every week, 2 weeks, or however often we need to progress that, and review to return back to sport.
Yeah. For footballers, just say how important it is that they maintain that groin strength, because it's not a sexy exercise, is it? We're not doing weights on our chest and arms and showing it off in tight t-shirts. It's just some strength in a part of the body that no one ever sees, very few people see. And but how important is it for footballers?
Oh, massive. I think actually looking at some of the statistics, I think behind hamstring injuries, calf and groin strains are up there. So it's one of those big things that actually keeps players out from the game or off the pitch. So again, if you can maintain that strength or maintain a good level of flexibility, whatever specifics it is that you need for your groins, it's vitally important to keep you on the pitch, which is kind of the most important thing. And that's the same for amateur through to professionals. It's exactly the same principles. The exercises are the same. You may do slightly different weights, and your demands are slightly different in terms of how much you run in, but the exercises are the same. It's just the levels that you're doing them at.
And if people have suffered from current groin injury or persistent groin injuries and they want to get to the bottom of it, is give you a call at the clinic there on the phone or via email?
Yeah. Email or phone call is easy. And we'll get back to you, and you can book online as well through the website if you want to look at the diary from there as well from your end.
Okay, great. Thanks, Tom. And if you've enjoyed today and you're a footballer interested in finding out some more about some common footballing injuries, we've got plenty more videos on the YouTube channel for you to have a look at. They range from subjects like trying to fix a torn Achilles, ACL repairs, and more commonly for most of us, am I ready to return to play again? Looking at various niggles and injuries we pick up whilst playing football. So please check out the the YouTube channel, and give us a follow if you're not already on there. If you'd like to find out a little bit more about Optimum Derby and Tom and the various services that they offer, from sports therapy to sports massage, then please check out the website there. And if you'd like to contact Tom directly, either for some advice or to talk about booking in at the clinic with an injury, Tom's email address is at the bottom of the page there. That just leaves me, Martin Crowson, to say thanks very much for joining us today on the second episode of our 4-episode series about football injuries. We are back next Wednesday at 4 o'clock, so we'll see you then. Tom, thanks as ever for joining us and giving us your expertise, mate. Have a good week.
Cheers, guys, and I'll catch you next week.
Yeah, and thanks for joining us today on Optimum Derby Live, and we'll see you next week. Thanks. Bye-bye.